Hello, and welcome to this video from Face Cancer video series. I'm joined today by Dr. Hiba Osman, and we'll be discussing palliative care. Dr. Osman, what is exactly palliative care?
Palliative care is a medical approach for patients with serious illnesses. And instead of focusing on the disease, we focus on the patient and how they're living with the illnesses. So we focus on reducing suffering and improving quality of life. And it's not just the patient, it's also the family or the people taking care of the patient. And we don't look at just the biomedical, but we also look at the psychological, the social, the spiritual, and the practical dimensions of the illness.
How is palliative care delivered?
What's specific to palliative care is that it's delivered through a multidisciplinary team. So the multidisciplinarity is very important. It's usually a team led by a nurse with the supervision or support of a physician, and usually includes a counselor, a social worker, or a psychologist, and in some cases a spiritual counselor, so that we address all the dimensions of suffering that might be affecting the patient. So the multidisciplinarity is key. Palliative care can be delivered at home, which is usually where patients prefer to be treated if they can avoid going to the hospital. That's generally people's preference, but it can also be delivered in the hospital through outpatient clinics, so patients can go to a palliative care clinician to make sure that their pain is adequately managed. It can be delivered in the hospital setting, so you can have consult teams that come and visit the patient when they're getting their chemotherapy, for instance, to make sure that they're tolerating the treatment well and that their other sources of suffering are addressed. And patients who have significant palliative care needs can be admitted to the hospital specifically to address their palliative care needs. So you can have hospices or inpatient units, hospital beds dedicated to providing palliative care.
Which cancer patients can benefit from palliative care?
All cancer patients can benefit from palliative care. There is a general misconception that it's only when treatment is stopped or when people have very advanced cancer. But effectively, if you think of what palliative care is about, it's relieving suffering and improving quality of life. And as you can imagine, from the date of diagnosis, when somebody hears that they have cancer, there is significant suffering associated, at least on the psychological and social level, with coming to terms with that diagnosis. And palliative care should be initiated at that stage. Any cancer patient should receive palliative care. And then the need for palliative care fluctuates during the illness. So at some stages when they are very uncomfortable or suffering for any reason, or adjusting to a new treatment or a new diagnosis or a new stage in the illness, palliative care plays a very essential role. And it goes hand in hand with the curative care. And then when they're settled and doing well and comfortable, they might need less palliative care at one stage and more palliative care in the future. So all cancer patients can benefit from palliative care.
We hear about hospice care in the United States and in Europe. Is that the same thing as palliative care?
Hospice care is part of palliative care. It's not all of palliative care. So hospice care is more a philosophy of care, and it's generally reserved for when people are in more advanced stages of illness. And I like one definition that likens it to natural birth and the birthing and natural birth dialogue, where hospice is more about accepting death as a normal part of life and helping people in their transition from life to death. We all know that we're going to die, and when people are in advanced illness, if we are more accepting, we can ease that transition when it's inevitable.
What are the most common misconceptions you encounter regarding palliative care?
The biggest misconception and the biggest barrier to people receiving the care they deserve is that palliative care is for when you lose hope and it's for the end. And we have many patients who get to palliative care too late because they are resistant, because they're still fighting and they don't want to give up hope. We know from studies, from research, that people who receive palliative care early on in their illness do better. They tolerate their treatment better, they suffer less, and they actually live longer. So this is the biggest misconception. Other misconceptions are that palliative care is only for the elderly. We know that young people with serious illnesses and cancers can benefit from palliative care as well. I know this is a cancer website, but also that palliative care is only for cancer patients. Also, non-cancer patients who have serious illnesses can benefit from palliative care. So palliative care really is for anyone who is suffering as a result of their illness, and anyone who is suffering and has a reduced functionality or quality of life can benefit from palliative care.
What are the most common challenges you experience with delivering palliative care in Lebanon and Middle East overall?
Well, one of the biggest ones is the misconception by not only patients but also physicians that palliative care is only for the dying and the end of life. People don't benefit from palliative care as much when they reserve it to when they've lost all hope and they're not receiving curative therapies. But also we have a major problem with truth-telling and sharing information with patients about their disease, and so much energy is invested in hiding the diagnosis from patients, especially when it's cancer, and then palliative care becomes something that, oh well, they might find out that they have cancer, and so that people don't reach out to receive palliative care because they're so busy hiding. The dynamics within the family, because we have such a close-knit family and people take control and take charge and try to protect their loved ones, actually end up hurting them and in the long run by hiding the truth from them, or by not seeking out certain kinds of services that the patient can benefit from.